Hi, my name is Jennifer and I'm a patient education specialist here at the Barbara Woodward Lips Patient Education Center at the Mayo Clinic in Rochester, Minnesota. Today we're going to give you a little snapshot about one of the classes we offer in our center titled Stress Management. Typically at the beginning of our classes we will assess our patients about their thoughts and feelings about what stress is and how it affects their life. But for this snapshot, I'll go ahead and just discuss what stress is, how it can be helpful and negative in our lives, and define acute and chronic stress. So stress is a very natural, normal part of our daily lives. It's physical and emotional response to all sorts of different situations. Maybe the birth of a child, maybe we're working towards a promotion at work, or maybe there's some conflict that's come up at work in the past few weeks. Also, it can be created by daily frustrations or internal expectations that we have on ourselves. Maybe we're trying to get the bills paid, or maybe we didn't feel like that presentation today at work went as well as we thought it would. It can also have a very positive impact on our lives. It can give us energy that can help us reach goals that can be directed towards action and change within our lives. Maybe we've been at a job for a few years and we're looking for something different, so we're taking classes at the community college to help advance our degree. Also, it can have a negative impact. Over time, it can lead to feelings of frustration, anger, tension, and so we want to try to learn how to deal with that, and our class would cover some of those strategies. Also, it's important to understand acute stress versus chronic stress. Acute stress is a reaction to an immediate event that happens in our life. Maybe someone brought us flowers to work today, or maybe our supervisor came to our office this morning and wanted us to try and get this project done sooner than we had expected. Also, we have chronic stress, which involves situations that are ongoing. Could be relationships that we have outside of work or within work. It could be workplace issues. It can also be financial or health concerns that we have. Next, we're going to talk about the stress response versus the relaxation response and how they have an impact on our health. Our bodies respond to the situations, our thoughts and feelings in two ways. We have the stress response and then we have the relaxation response. First, we're going to talk about the stress response. The stress response is an automatic response that our body goes through. It's the fight or flight response. For example, let's say you're crossing the street downtown here at the clinic and you have the right of way and you enter the crosswalk and you begin walking and a car comes around the corner, nearly hits you, you're going to jump back. That's that fight or flight. It's that automatic protective mechanism that we have. In those situations, those stress hormones are released, adrenaline and cortisol. Well, this all takes place in the reactive part of our brain. Now, when we tap into this reactive part of our brain, our blood pressure goes up, our heart rate goes up. So our heart is actually beating faster. Our breathing becomes fast and shallow, and our muscles increase, muscle tension increases. As I mentioned in the introduction, stress can occur over little things or big things in our lives. This reactive part of our brain, since it's automatic, it's very easy to tap into. Like I said, it could be fear. Maybe you're fearful you're not going to get that promotion at work, or you feel threatened. Could be anxiety or danger. It can be acute things, it could be chronic things, it could be short term. Maybe you feel anxious, you have to have a blood draw today at the clinic. And so knowing that this is automatic, and if we constantly tap into that, over time, it can lead to what we call a slow burn. Or like I tell patients, are signs and symptoms of stress overload. And all of us have different signs and symptoms. Some of us just have physical symptoms such as nausea, maybe we get dry mouth, emotional things, maybe we're more irritable, we get anxious. Sometimes we actually have changes in behavior. Maybe we show up late to work more often, or we use more of our sick time. We want to learn strategies to manage our stress so that we avoid that slow burn, or we minimize those signs and symptoms of stress overload. Now, each of us are different, so knowing what your symptoms are is going to help counteract that. Now we're going to discuss the relaxation response and how that can counteract the stress response. The relaxation response of course, it's not automatic. It's something that you can learn about. So if you are in Rochester and would like to take our class, you could try that option, or finding some reliable materials that you could purchase or find within your local area to help you learn more about stress management, but especially the benefits of the relaxation techniques. And then explore is also important. So maybe trying something to help manage your stress or help you relax that you've been thinking about trying but haven't, but look into it more. Maybe take a yoga class through your community education offerings. And then practice. Practice is really important once you find those things that work for you, because this all occurs in the reasoning and thinking part of our brain. When we tap into that reasoning, thinking part of our brain, our blood pressure and our heart rate actually decrease. So our heart slows up, our breathing becomes more shallow and slow. Sometimes we actually focus on our breathing if we're doing some formal types of relaxation like meditation or yoga. And also, our muscles aren't so tense. We're not carrying around that stress in those muscles. The thing is, though, this relaxation part of our brain, like I said, it's not automatic. So it's the pathway to that part of the brain is narrow. Not really that the nerves are narrow, but they're not highly traveled like the reactive part of our brain. But if we can begin practicing relaxation techniques, trying techniques to help manage our stress, we can begin to widen this. So then in the end, it is our choice. Are we going to allow the stress to take us to the reactive part of our brain and allow us to go to that slow burn or signs and symptoms of stress overload? Or are we going to be able to think and reason through those situations more? Let's say, for example, I live in New York City and traffic stresses me out. And I always go to the reactive part of my brain. By the time I get to work, I'm exhausted, I'm agitated, and it just kind of messes with my whole day. But now I've taken yoga, I'm learning more about deep breathing, and I can tap into that reasoning, thinking part of my brain and think, maybe there's an accident ahead, or with all this construction, tomorrow I'm going to take a new route. So this can help us deal with stress within our lives. In our class, we encourage our patients to come up with a self-care joy list. So the self-care things are going to be eating healthy, exercising, getting enough rest, those self-care things that our bodies need to function in life. But also those things that bring you joy. Could be gardening, could be meeting a friend for a cup of coffee. Also doing some formal types of relaxation, yoga, tai chi, meditation. There's whole lists of things that you can do are going to also help tap into that relaxation part of the brain. And if we would meet with you, we would talk more about specific things that bring you joy in your life. So we've talked about what stress is and how it can impact us emotionally, physically. We've also talked about the stress response and how the relaxation response can counteract that, and the importance of taking good care of ourselves, doing things that bring us joy, as well as those formal types of relaxation. Now, with our one-on-one classes, we would go into more specifics about stress management strategies that you would like to learn more about. Some of them include humor. Using a sense of humor can be very beneficial for managing our stress. Being able to live in the moment is one topic we talk a lot about, as well as being active within our lives, eating healthy, how that can help us deal with stress, staying connected to others, people of all ages, practicing relaxation techniques, how can we incorporate that throughout our weekly routine, and then of course caring for yourself first. Sometimes that's a big thing that we need to understand in order to manage the stress within our lives. I'd like to thank you for watching our little snapshot of our stress management class that we offer here in our Patient Education Center. If you are a Mayo Clinic patient and are interested in taking our class or other classes that we offer, please click on the link below and give us a call. Thanks for taking a look at our snapshot of our stress management class today, and hopefully you found this helpful.